Good morning, everybody. Thank you so much for having me. I want to thank the LFA as well as Dr. Timlin for inviting me today. I'm really honored to be here to be able to share these slides with you and answer any questions that I might be able to help. So today we are obviously focusing on the skin and hair and how lupus affects you and your skin and hair. I have no financial disclosures to reveal. And as we already alluded to, I'll first go over some of the common skin findings of lupus patients, as well as the hair loss we will also cover. And thank you, Kimberly, for sharing all of that life story with us. And additionally, finally, I'll end with what you as a patient can do to protect yourself, besides from what dermatologists and rheumatologists can offer you to treat your lupus. So lupus and dermatology, one may ask, oh, why dermatology? How does this really involve lupus? It is a rheumatologic disease where a lot of our patients see rheumatologists. Dermatologists cover a lot of different parts of your body. So we treat the disorders of the skin, the hair, as well as the mucosal surface. So that includes the mouth, genital, the eyes. And we often share our patients, oversee our patients with ophthalmologists, gynecologists, as well as urologists, as well as the nail. And the fact is that vast majority of our lupus patients will experience some form of dermatologic manifestations during their disease course. And frankly, the number may be even higher than 80%. So diving right into what we know well about skin lupus, also known as cutaneous lupus, there are really diverse manifestations of skin lupus. So to your very left, you can see this classic presentation of what we call butterfly rash. And this can really vary from being subtle to very severe. And then in the middle is a condition called subacute cutaneous lupus, where you get these circles of rash on your chest, your back, arms, neck, sometimes on the head and neck area that can be quite widespread. And then finally, to your very right is a condition called chronic cutaneous lupus, or very commonly known as discoid lupus. So lupus, skin lupus and systemic lupus have a strong relationship, and depending on the type of skin disease that you have, your risk of developing systemic lupus can really vary. So the butterfly rash that I alluded to is really only seen in those with systemic lupus. Whereas the ones with discoid lupus that I showed earlier in the previous slide are much less commonly associated with underlying systemic lupus. And then subacute lupus is somewhere in between. And the skin really is a window to your lupus. This is actually a criteria called SLIC criteria that we doctors sometimes use to classify lupus patients. And the first 4 clinical signs, what we see on when we examine you and things like that, are actually dermatologic conditions. So that can include skin lupus, ulcers in your mouth, in your nose, and also hair loss. So going back a little bit more deep, diving a little bit deeper into different types of skin lupus, the most common form of skin lupus known as discoid lupus. We believe that about up to 15% of the patients that have discoid lupus will develop underlying systemic lupus. And hence, it's really important for you to follow up with your dermatologist and your rheumatologist to ensure that you are being examined, worked up appropriately to ensure that you're not developing more additional concerning signs of lupus that you may not be able to see in your body with your kidneys and things like that. And sometimes my patients that I see, they come in and we diagnose with discoid lupus, and I tell them about these things, and sometimes they don't follow up, and I sometimes worry about how my patients are doing when that happens. And I hope that you do follow up with us so that we can make sure that you are safe and treated appropriately. Other thing about discoid or chronic skin lupus is that it is a scarring process. So anytime I say scarring, this is a permanent process. There is no going back. So it's really important for our patients to recognize that and seek care when something is off instead of waiting to be seen because they're worried that it's too embarrassing. Because we're really here to help you to manage your symptoms and conditions as quickly, as appropriately as possible. The next condition, subacute cutaneous lupus. More than half of our patients with this skin condition actually do meet the diagnosis of systemic lupus. However, what's important for our patients is that we always need to rule out sometimes a medication that you're being prescribed may be causing this type of skin lupus. And I see it commonly, and I just came off from the service at the hospital and just diagnosed with this condition, who had heartburn medication. They were on a heartburn medication and developed a very severe form of subacute cutaneous lupus. And thankfully, this patient does not have systemic lupus, but not many doctors may be aware of that. Your dermatologist and your rheumatologist will be aware of it, and you should be aware of it. And it's also possible that these conditions, patients with underlying lupus may take these medications and develop this. So it's important to follow up again and assess this and go over everything for us to stop these medications if necessary so that you don't get additional signs and symptoms. And then finally, the butterfly rash, the classic butterfly rash of lupus. You know, here I wrote more than 95% of patients do have underlying systemic lupus. However, it's more likely that really, honestly, everybody with this type of form of lupus, skin lupus, do have underlying systemic lupus. When it's really severe, it's not hard to recognize this. When it's mild, though, it can be quite difficult, even for dermatologists. And sometimes you may need a skin biopsy, may need additional blood work to see what's going on within your body that we can't see. And your rheumatologist and dermatologist will help you with that as well. So that's the major kind of skin findings of lupus. And I'll move on to hair loss. So alopecia is a fancy term that we doctors like to use to really represent hair loss. Hair loss occurs in a lot of our lupus patients. Hair loss in general, whether it's related to lupus or not, is an extremely challenging condition to diagnose and treat. And what I mean by diagnosis, there are many causes of hair loss. And to pinpoint what's causing the hair loss is extremely challenging. And what you should be aware as a patient living with lupus is that not every hair loss is due to lupus. So if you're getting new signs of hair loss, you should seek care, you should talk to your doctors and be appropriately worked up and managed to ensure that we're not missing anything. Or not just saying this is all lupus. So again, coming back to the word scarring. Scarring hair loss is a big group of hair loss I think of as dermatologists. When I see a patient with lupus or with hair loss who come in with hair issues. And then other form is non-scarring hair loss. Again, scarring is permanent. And this is something that should be addressed sooner than later, because once you have a scarring, there is no going back. Your hair loss is, the hair follicles are gone. So to your very left is a form of discoid lupus presenting on the scalp, leading to scarring hair loss. In the center here is a condition called central centrifugal cicatricial alopecia. It's a fancy term, so I just call it CCCA. That is extremely common. It's epidemic among my Black female patients. Super common where you get hair loss as a genetic component. This is not associated with lupus. One can have lupus and can also have this, but you wouldn't know this unless you are appropriately worked out. And then to your very right is a little less common condition called lichen planopilaris that can mimic skin lupus, discoid lupus, even on skin biopsies. And what we also know is that there have been studies done to see that hair loss or scarring hair loss due to discoid lupus is much more common in Black patients compared to other patients with different skin tones. So again, these are things that preferentially affect specific patient populations, unfortunately. And again, you should seek care anytime you notice something to treat accordingly to prevent any further hair loss. Going to non-scarring hair loss, which is the other big class of hair loss. This is also perhaps even more challenging. To your very left is, I called it acute lupus. And the reason being that patients with this type of hair loss, where their hair is shedding, it can be very global, it can be throughout your entire scalp. It can be more patchy, different areas of your scalp. It doesn't necessarily lead to scarring, but can be very dramatic as well. These are patients that usually have underlying systemic lupus that's not well controlled yet. That means that whole overall treatment of lupus needs to be managed along with our rheumatologists. In the center is pattern hair loss. So as you guys all know, men have a lot of hair loss as they get older, but that's also quite common in women. And you can have lupus, and as we all get more mature and older, we will have some hair loss. So, and again, skin biopsies and things like that, things can help you diagnose that, and that we have different treatments for this compared to something like acute lupus leading to extensive hair loss, hair shedding. And then finally, there is a condition called telogen effluvium, which is another very classic form of non-scarring hair loss that can be seen with lupus, but also sometimes with other things. Even starting a new medication can cause this. Going through emotional stress can cause this. But also having a lupus flare, going through that medical difficult time in your life, can also trigger this. So again, the treatments and the prognosis, what to expect, it's all very different for these individual type of hair loss. And that's why you should, again, seek care when you notice something. That way we can help you guide you in the right direction. So alopecia, a correct diagnosis is really important in optimal management. People do blood work, but this doesn't exactly tell you. And sometimes you may need a scalp biopsy with your dermatologist. Scarring hair loss is permanent, so I don't want you to wait, suffering on your own. We are here to help you. We're here to guide you. So I hope that you can see us so that we can try to treat you. Additionally, hair loss, whether it's related to lupus or not, is an extremely common condition. So what not to do? When I see a lot of my patients who I see for scalp lupus, hair loss, a lot of times they're on biotin. Biotin actually does not work. There's been really no data to show that biotin works. And biotin, by the way, is a type of vitamin B. And it's not without side effects. It can cause acne. It can cause lab abnormalities, including your thyroid function test. For men, it can cause your PSA levels to be different, which is for your prostate. So I really never, ever recommend taking biotin for hair loss. There are many supplements that are over the counter that's not overseen by FDA. You should really talk to your rheumatologist and dermatologist before starting a new supplement, because certain ingredients can actually flare up your lupus, skin lupus, systemic lupus, among other things. And more importantly, it's really important that you don't give up. Hair loss is challenging, as Kimberly already shared with us. It is a chronic condition, and there are things that we can do to help you to treat this so that we can help you then. So I don't want you to give up. So it's not just hair loss and specific skin lupus that affects you when you have lupus. There's other dermatologic conditions that you can get when you have lupus. And the one that I'll focus on is called photosensitivity, because I want to talk a little bit about sunscreens. But besides photosensitivity, so this is a very loose term. So some patients, they might get more sun, that their skin might become really sensitive days after getting sun exposure. Sometimes this could mean that your lupus flares up after you get sun exposure. Sometimes it could be just a skin lupus that flares up getting the sun exposure. But you can also have dry skin, you can have itching associated with dry skin or not associated with it. And then you can also get skin discoloration called poikiloderma. So poikiloderma is a term that we use where your skin becomes light and dark. It looks a little bit pink, a little bit red, and the skin feels very fragile and thin. And this is a common phenomenon seen in lupus patients, as well as other patients with other autoimmune conditions that somewhat mimic lupus. And this somewhat relates to photosensitivity. So what can you do besides seeing your rheumatologist and dermatologist, taking your medications to protect yourself? The two main things that I want to mention are sun protection, UV protection, and smoking cessation. So if you're a smoker, it's really important that you try to reduce this, work with your doctor, because we've seen that this has been associated with difficult to treat lupus. And medications don't work quite as well for whatever reason. And then finally, with UV protection, you really should be wearing sunscreen every day. You are someone living with lupus, whether that's skin lupus, systemic lupus, whatever that may be. So sunscreens. So there are two main types of UV that we encounter in our lives. UVB, which is a sunburn ray, so that causes sunburn. UVA, which used to not be thought to be a bad UV, but we now know that it can also cause skin aging, skin darkening, and also a flare-up of your lupus. They've done studies specifically with UVB as well as UVA. There are two types of sunscreens. One is called physical sunscreen, other one is called chemical sunscreen. Physical sunscreens are those that leave white, thick paste. It's hard to blend in. They have zinc and titanium in it. However, it's better for those with very sensitive skin because it doesn't usually irritate the skin around the eyes and things like that. A lot of my patients who have darker skin tones, because oftentimes a lot of my lupus patients have more melanin in their skin, have a hard time tolerating this type of sunscreen. Chemical sunscreens are more cosmetically elegant. It does not usually leave any type of discoloration. It doesn't make your skin gray, purple. It blends in nicely, but it can sometimes sting around. So I tell my patients, choose a sunscreen that you're going to use. Because if you're not going to use it, I can tell you what to use. You're never going to use it. It's not going to be helpful for you. Okay? So how do you read a sunscreen product? It's so confusing, even for, I think, doctors. There's so many different things on it. What you want to look for is broad spectrum sunscreen. What that means is that it covers both UVB and UVA. SPF number primarily really refers to UVB in the US. So SPF 30 covers about 97% of the harmful rays, whereas SPF 50 covers 98%. It's not a huge difference, but I always recommend my patients to go for a higher number. The reason being that none of us use enough sunscreen when you are actually applying it. You're supposed to use minimum of 1 ounce of sunscreen to cover your average size person's body when you're out in the sun. Entire shot glass, 1.5 ounces. When you buy a small bottle of sunscreen, if you're out there for a whole day, you're supposed to be going through the entire bottle of that sunscreen, which no one does. And the sunscreens that we have in the US have mediocre coverage when it comes to UVA, unfortunately, because sunscreens, the FDA monitors it, and it's been a long time since we approved any newer sunscreen filters that are available in Europe and in Asia. So what are some tips that I give my patients? Layer your sunscreens. Do buy a moisturizer with SPF, and then top that with another sunscreen that's a standalone sunscreen. You do want to apply before you are exposed to the sun. And then you're supposed to reapply a sunscreen every 2 hours. You want to avoid direct, intense sunlight during the hours of, say, 10 to 4 p.m. And there are even UV protective clothes that people that they sell that can give you a long-lasting, obviously, protection from the UV. So in conclusion, dermatologic findings of lupus, so that could be skin lupus, hair loss, other signs that I talked about are extremely common and also extremely challenging to treat, actually. You should find a dermatologist who really specializes in lupus, also work with your rheumatologist so that they can help you to their best ability. And a couple of things that you can do as a patient is that wear a sunscreen, even if you're not going out in the sun, even being next to the window, you get UVA through the window, and you should wear a sunscreen every day if you're someone living with lupus. And if you're a smoker, I really encourage you to, not only for lupus reasons, there are other many health benefits of quitting smoking. I really encourage you to do that. So again, I want to thank Dr. Timlin for inviting me to the talk. I want to thank LFA Foundation for, again, having me here. This is some of our information here in case you are interested in seeing us and if we can be of any service to you. Hopefully I'll see you in our clinic. And then I'll take any questions at the end of our presentation.
Wonderful. Thank you so much, Dr. Kang. And I know we have a bunch of questions in the chat already. So please, if you have any additional questions, to throw them into the chat and we will work to get through as many as possible at the end of our next presentation. So that leads me to then introduce our last speaker for today. I would like to introduce Arnita Roberts-Christie, who is a patient engagement liaison from GSK. She will share a presentation on shared decision-making with us. Thank you so much, Arnita, for joining us today. And thank you so much for yours and GSK's support on this program. If you want to just share your screen and then we can get started.
Hi, good morning, everyone. I will share screen. And from the beginning. Okay, oops, I went too fast. Okay, good morning, everyone. And I, of course, the presentation from Kimberly, and Kimberly, again, I know I put it in the chat, but I also want to say it to you personally. Thank you so much for being vulnerable enough and trusting us enough to share the real you, the true you, the you under all of everything else. I can only imagine how helpful it was to others that are on the line. So thank you, thank you. And Dr. Kang, I learned a lot today about skin as well as how to address. So thank you for your presentation. Ms. Arnita Roberts-Christie. I am one of the patient engagement liaisons at GlaxoSmithKline or GSK. And what I get the joy of doing and is to travel around the country sharing information about lupus, about the disease of lupus, and answering questions, encouraging, empowering. And so today, you know, I am a registered, let me also get out some disclosures. I am a registered nurse, but I'm not here to talk about diagnosing you. I'm not here to encourage you with any particular type of medication. What I am really here is to encourage you to ask additional questions that you may have been a little bit, I'm not sure to ask that question, or I'm not sure how to articulate what I want to say. I'm here to encourage you to, you know, put the words together, to ask the questions, to take someone with you. And so today we're going to talk about shared decision making, and it's partnering with your healthcare team to make your voice heard. Although you may not realize it, your voice speaks volume, and it speaks volume even when you don't use your words. And so your nonverbal communication also speaks volume. And oftentimes those that love you and that are around you a lot of the time, they can read your nonverbal, but your doctor may not. They may not be able to look at Arnita's face and say, oh, she's having a real tough day, or look at Kim's face and say, she's having a real tough day. And so that's what we've got to talk. That's what we've got to share. We've got to communicate. And that decision-making process has to be a joint process, a process between you and your healthcare provider. The relationship between you and your healthcare provider is so critically important. You know, my mom used to say it needs to be something like bees to honey. You guys stick together. And that is because you know your body better than anyone else. You know when it's not right, even though you don't feel right, the fatigue is really getting to you. And the physicians, the healthcare providers, they understand how to treat lupus. And so the two of you together, is where the shared decision-making comes into place. And that was all a setup for this next slide. Let's talk about the basics of shared decision-making. And as you see from this picture, there are a number of different bodies, and they can all represent different healthcare providers that are on your team. And they can present different members of your family. And if you've ever heard me present before, I often talk about the village. It takes more person to support you as you are on. Question may, you may come up with, okay, Arnita, then what is shared decision making? I'm glad you asked. So it involves a couple different areas. Number one, it is collaborative. It is cooperative. Cooperative starts with you in the center of everything. This lupus journey, how have you lived on this lupus journey? How do you want to live going forward on your lupus journey? All of that is your experience. What are your preferences? How do you see things? What are your goals for yourself? Do you want to be able to walk a certain distance without becoming fatigued? Have you communicated that to your healthcare provider? Are your values such that they interfere or make sure that you communicate that about collaborative healthcare provider is. They have the experience, the training, as well as the expertise to help you along this journey, along with the clinical evidence to support the decisions that they make, the treatment plan that they make. But again, you have got to communicate with them. If they decide, if Dr. Kang says, well, I want you to use this, and you use it and you don't see a difference, he needs to know that, because he may go away and say, oh, I gave Arnita this is working really well, and it's not. And so I need to be able to say, Dr. Kang, I know you're really trying hard for me, but this is not working. I didn't see a change. That's information that he needs. And then communicating with your loved ones, talking to them about where you are on your journey. I often talk about a fatigue scale. If you are feeling great, you can do a lot of things. Your fatigue might be a 2. But if you are challenged by fatigue on a certain day, your fatigue might be an 8 or a 9. Does your family know where you are on that scale? Because that can help them understand what to expect from you as you're living this. Shared decision-making is an ongoing conversation with your healthcare provider, with your family, with your loved ones. And there is a goal, and that goal is to make the best choices for your health. But again, it is shared. It is you and your healthcare team coming together to make the best choices for your health. They should not be done independently, because if you're prescribed something, or you're, asked to follow a certain treatment protocol and you don't want to do it, or you don't do it, which means you're interfering with the adherence of it, then it's not going to work for you. And then no one wins when that happens. And so why does shared decision-making matter? I kind of alluded to that a little bit, but treatment plans for chronic illnesses can be complex. You're taking certain medications, certain times of the day, certain days of the week, you're taking them with certain things. Well, that's what the healthcare provider is prescribing. However, it's got to work for you. And there's really no single right answer. We often say in the lupus community, one person diagnosed with lupus is one person diagnosed with lupus. Treatment plans that might work for your friend diagnosed with lupus may not work for you, and vice versa. So again, the shared decision-making really comes in with you and your healthcare team together, making the decisions that are right for you. And so your voice, I've said this more than once, but your voice and your values are critically important to your lupus journey. Make sure that your voice is heard. And you may say, oh, Arnita, I'm not sure what words to use, and I don't talk, quote unquote, doctor talk. It's okay. Write it down. Practice it before you go into the healthcare provider's office. And you can also take someone with you. But the most important thing about it is to communicate with your healthcare provider. And being proactive, I applaud all of you for being on this call today, because you're taking the step ahead of time to make sure that you are learning all that you can about your skin, about your hair, and about shared decision-making. And so making a healthcare decision, what is your role? We've reviewed it, but let's review it again. We know that your role should be proactive and staying engaged. If you were on last week, and if you were not on last week, staying engaged, meaning that you are participating in your healthcare education and in your healthcare understanding. Know your values, know what you prefer, and have some goals set up for you. discuss those goals with your healthcare provider, because you want to make sure that you are on the same journey as they are in terms of your goals, and own your health story. I heard Kim say earlier that sometimes she was embarrassed by what she saw, you know, in terms of her physical appearance, and that kind of made her hesitant to share. That's her health story. But when she shared it, when she was allowed herself to be vulnerable enough to share that story, I can only imagine how much support she did get and how people did embrace her. So I encourage you to share your story and to share your journey. I often tell patients, you know, in sales, we talk about having a 30-second elevator speech. And that means that when you walk into the elevator in 30 seconds or less, you need to be able to share with someone what lupus is and how it might affect you, even if they knew nothing about sales. That's where I was going. And so I'm going to transfer that over to lupus. Have a 30-second elevator pitch that you can share what lupus is, how it affects you. It's an autoimmune disease. It's a chronic disease. Sometimes I get tired. Sometimes I look phenomenal, but I feel crappy on the inside. They need to understand that, and you need to be able to share that with them. And so prepare for your health appointments. That could mean writing it down. Okay, when I get into the doctor's office, sometimes I've been sitting in the waiting room and I'm not exactly sure of, you know, when I get in there, they go, "Oh, Arnita, how are you feeling?" I go, "I'm fine." And that's really not how I feel. But sometimes I get so flustered or I get confused that I go, "I'm fine." But what would help me is if I write down questions before I get into the doctor's office. And I have those questions with me and they go, "Arnita, how are you feeling?" Or "How did you feel since the last visit?" Or "Did you have any certain days that you didn't feel good during a certain week?" And I can pull out my journal or my symptom tracker and I could say, well, you know, the third week of the last 2 months, I've really not felt well. And that will give the healthcare provider an opportunity to ask more questions and really dig in to see what's going on with you. And that can be really helpful as the two of you in this shared decision-making process make decisions for you. And so when is it time to make a health decision? Well, when you both think very carefully about the decision that is going to be made, when you get all of the information that you need, you ask questions, you get answers to those questions, you partner with your healthcare provider when it's time to make a decision. And partnering means if something is suggested or recommended, that you understand what the risks are versus what the benefits are, that you are weighing that information to make the best decision for you based on your values and your preferences, that you are, again, engaged once the decision is made. If a decision is made with your input and it's not working for you, that right away you communicate with your healthcare provider what's going on. And then involve your support system. I call the support system your village. And that can include your healthcare team, your loved ones, your neighbors, your coworkers, your colleagues that you go to school with, because we know lupus affects women primarily in childbearing age. And so perhaps you're a college student and your classmates need to understand what lupus is and how they can support you. You may even need them to take notes for you on a certain day because you just can't make it to class. But they won't know that if you don't communicate with them, if you don't talk to them. On a different slide presentation, I have a picture of someone who is laying on a couch and they have their computer in front of them. Sometimes you need to look at your loved one and say, "This is how I feel and I need your help." But they won't know that unless you talk to them. They may not pick up on the nonverbal cues that you are blasting out. They may not get it. So I need you to talk to them, to verbalize with them. And remember that shared decision-making is a process. That means there's no end time to it. It is a journey. It's a process. It happens over time. And you may need to change and adjust to that process, but stay in the process and commit to being engaged. And so I thank you for joining. And I'm actually if I could, and I'm going to QR code. Now, I may not have mentioned this before, but if you have your phones out, I would ask that you would take your phone up to this QR code for some additional resources that GSK has. And so GlaxoSmithKline has a program that's called usinlupus.com. And so if you don't have your phone available, you can also go to the website called usinlupus.com. On that website, there's the website, there's a Facebook page, there's a Twitter, there's an Instagram that you can join. And that usinlupus.com is an area where you can meet other lupus warriors like yourself. We put information up there, tools and resources that you can have, as well as lupus warriors will put information up there that they want to share. Sometimes a warrior may be on there and they say, I'm not feeling so well, and someone will type in words of encouragement. So I'm going to, again, scan that QR code if you would. I would really appreciate it. As well as you can go to usinlupus.com. And if you scroll down, you can put your email address in to receive additional lupus information and resources. And so with that, I am going to stop sharing screen. And I think that's it.
Awesome. Thank you so much, Arnita. You shared such amazing tips and tools and resources with us. I'm so appreciative of you joining us today. I know we had so many awesome questions and answers in the chat, but there are a few that I want to make sure we address kind of out loud to the whole group. I would love Dr. Kang to start with the vitamin D questions. I think that'll be a really great way to start, and then we can get to a few. I know you did an awesome job answering in the chat a few of these, but I think addressing to the full group so we can make sure everyone saw this.
Definitely. I think the vitamin D question was regarding whether about the sun protection and vitamin D. Yeah. So vitamin D deficiency is very common, in general, in the general population. So that should be addressed. So a lot of times when you see a rheumatologist and dermatologist treating these conditions, they will check the vitamin D level and they will supplement that. At the same time, you should still do sun protection. So it's really, you should be doing both of them. And there are some, studies to show that vitamin D deficiency can actually worsen your lupus as well. So there are some pathogenic mechanism with vitamin D. So that needs to be appropriately addressed.
Perfect. And I know a lot of people in the chat have asked questions about the UV protective clothing. So if you could just kind of address kind of what that is and like how that does benefit the UV sensitivity.
Definitely. So I love UPF actually. So because it's on there the whole time, it doesn't rub off like sunscreens. So I highly encourage you to look into that. It can look a little bit silly when you're at the beach and wearing all of this, but you got to do what you got to do to protect yourself. I also encourage my patients to wear sunscreen underneath it, because even if you're wearing UPF, there's a lot of exposed areas that you're not covered, right? Head and neck area, your arms and hands and your legs and things like that. So always, again, layer your sun protection with moisturizer, with sunscreen, with UPF. You can't do too much, honestly.
Wonderful. And then I think the only other sun question before we move into some of the hair loss questions are the people with darker skin, should they still be wearing sunscreen? Like what natural protection? Just kind of share more details regarding that question would be wonderful.
Absolutely. So patients in dermatology, one of the very common classifications that we use for skin type is Fitzpatrick 1 through 6. So I'd be someone around 3 3, 4 maybe, and then it goes all the way to 6. Even those with more pigment in their skin, more melanin in their skin, so Fitzpatrick 4 to 6, those patients only have natural SPF of maybe 10 to 15, which is far less than what you really need to get a full protection from the UV. So I think someone told me that they're a doctor don't need sunscreen because they're a darker individual. That I disagree with that completely. So I would encourage you to wear a sunscreen.
So then I just want to move over to some of the hair loss questions that we have in the chat. I know people were asking for treatments for hair loss. Someone mentioned Nutrafol and minoxidil. So if you could just share a little bit more about kind of treatments for hair loss or kind of next steps for those who may be struggling.
Absolutely. So minoxidil is the generic name for Rogaine. So I'm sure a lot of people are aware of Rogaine. Over the counter, very commonly used for men. So really any patient that's suffering from hair loss, I often recommend topical minoxidil. That's one of the few medications that have studies and evidence to show that it can help with hair growth and helps by lengthening the growth phase of your hair follicles actually. Side effects is irritation and you need to do it all the time. So that's one caveat. Nutrafol is a supplement that has many ingredients, including marine extract, among other things, saw palmetto, which have some evidence to show that it can help with hair growth. And they themselves, so Nutrafol, have done studies to show that it can help with hair growth. I don't routinely recommend it for a few reasons. It's extremely expensive. So when the benefit is going to be relatively minor and there's a chance that one could cause issues, that decision, I leave it up to the patient, whether they really want to invest the money and time into doing that. But when they ask me, is there evidence, is there data? I tell them, yes, there is some evidence it can help. So, if you're really wanting to do everything you can, that's something that is reasonable. And a lot of the hair experts in general will use that. But again, it's something you got to take it all the time, every time to see the benefit, and it is quite expensive. And I just want to make sure I have no association with any of these products, brands, anything like that. So
wonderful. And I think another question about kind of treatments. So for non-scarring hair loss, are there common treatments to help regrow hair? If you could share any more information about that.
Again, that goes to what is the underlying cause of your hair loss. So you need to, again, be appropriately evaluated, get the workup done with your dermatologist. Once that is, done, I think then you can get a better recommendation of what needs to be done for your health. But there are options. So again, I encourage you to see someone who specializes in hair loss. And if you're someone with lupus, certainly lupus experts.
No, that's a wonderful reminder that to make sure that you, anything that's happening, to just really direct them to your medical care team. They are the best people equipped to help you treat your lupus and your symptoms. I'm not sure if I saw it. I wanted to make sure I get all of the questions from the chat. So I'm just kind of filtering through again. We just had one come in about proscriptics for hair loss. Dr.
What for hair loss?
Proscriptics. I'm not sure if I'm pronouncing that correctly.
Proscriptics. I'm not familiar with that. Do you know what's in the generic name of that medication? Is it a supplement? I may not be familiar with that supplement if it's a supplement.
So yeah, I would definitely recommend chatting with your medical care team kind of about those products, because especially as Dr. Kang mentioned about biotin, and really just kind of making sure that your doctors know what supplements you are taking. I'm not sure if the updated chat is helpful to you, Dr. Kang, about ProPill FX Daily NutriBoost.
Yeah, I mean, I think these are all over-the-counter supplements, which I don't know every one of them. There are two that, again, have done some studies and that are more widely used, and those are Nutrafol and Viviscal. So they're all relatively similar in some benefit. Again, you should bring these ingredients that you are considering taking in to your dermatologist and review with them. That way, because there's so many of them out there nowadays.
Perfect. And then just to kind of circle back to that vitamin D question, if people are out in the sun and they're covered in sunscreen and they're wearing the PF protective clothing, will they still get the vitamin D that they need?
So like I said, you know, a lot of us, those don't, because we don't, there's a very small percentage of patients who wear sunscreen, right? So I believe the number is, I think 10-15% regularly wear sunscreen, something like that. And then if you look at what percentage of patients are vitamin D deficient, it's quite high. So even if you're wearing sunscreen, I mean, you should wear your sunscreen because, you know, you have other medical issues, right? Vitamin D, that should be addressed separately. If it is low enough, that should be supplemented. There are pills that work wonderfully to address those issues. So I honestly wouldn't try to combine the two together. Those are two separate issues. You wear your sunscreen, you treat your vitamin D deficiency.
Great, thank you. And I know we had some questions on hydroxychloroquine and hydroquinone for dark patches. If you could share anything about that.
Yes, so I think hydroquinone, I didn't see the exact question, but that is a common ingredient that we use in skin bleaching, skin lightening. FDA has come out and gave some warning signs about carcinogenicity, so meaning increased risk of cancer. If you look at the literature, how long it's been used, you know, the percentage that's where we use it, that is overblown by far. I believe that it is a safe medication, especially at the, you know, as long as someone's overseeing the treatment. It is a controlled medication, meaning someone's not giving you 20% hydroquinone. There are, you know, a specific percentage that's safe for the patients. So that's one thing. It can do good things for skin lightening, but it depends on where the skin issue is. So discoloration can come from the top layer of your skin, sometimes in the deeper layer of your skin. If it's in the deeper layer of your skin, the hydroquinone is not going to do anything. If it's in the superficial part of your skin, it can help. Hydroxychloroquine, I use that commonly for skin lupus. That's probably the first line that I do for patients who don't respond to topicals or have other reasons why they need to be on Plaquenil or hydroxychloroquine, which Dr. Timlin would be able to even answer more questions about. So it is an effective medication. It just needs to be, there are certain things that need to be monitored, but I do believe that it's a very effective medication for skin lupus.
Wonderful. Well, thank you so much for your time today, and thank you so much to all of our speakers. I think it was such a great event, and I personally learned so much just about ways to better protect myself. So thank you, Dr. Kang. Thank you, Kimberly, for sharing your story with us, and thank you so much to Arnita for sharing so many resources and tips with us. If you have any questions at all additionally or want to follow up, you can reach me at bennett@lupus.org. I also want to quickly share a QR code with you all. This is our post-event evaluation. If you guys hold up your camera to the screen, I will also share this link in a post-event evaluation, or post-event email as well. Your feedback highly shapes our programs, and I would love to know what you thought about today's event, and it'll help form future programs as well. Again, thank you so much, everyone, for joining us on a Saturday morning, and I hope you have a great rest of your day and weekend. And I look forward to talking with you all soon. Have a wonderful day.
Thank you very much.